As you know, last night we announced 3 deaths from COVID-19 that prior were unknown to us. 2 of these individuals died in early February and 1 died in early March, and all 3 were occurred before what we had thought was our first death on March 9th. So back in early February, as you may remember, we did know that we had COVID-19 in our county, but we had not yet identified our first case of community transmission. That didn't happen until February 28th. What these deaths tell us is that we had community transmission, probably to a significant degree, far earlier than we had known. And that indicates that the virus was probably introduced and circulating in our community again far earlier than we had known. We know that each of these deaths, especially since there are 3 of them in February and early March, they're really like iceberg tips. So they're indicators. When you have an outcome like death or ICU, that means that there's some iceberg of cases of unknown size that underlie those iceberg tips. So with 3 of them, that tells us that there must have been, a somewhat significant degree of community transmission.